Millions of people snore every night, and many don't realize they're harming their heart and brain. If fatigue, daytime sleepiness, or that loud snore runs in your household, you need to know what really works to stop sleep apnea, because the wrong treatment is like leaving the enemy at your doorstep. I'm Dr. E.I. Williams, a board-certified physician, and today we're diving into sleep apnea treatments that actually work, backed by the latest science and tailored to you. In our previous video, we uncovered what obstructive sleep apnea, OSA, is and why it's dangerous. Repeated airway collapse during sleep, intermittent hypoxia, brain-wake fragmentation, and cardiovascular stress. Untreated OSA can raise your risk of high blood pressure, heart attack, stroke, atrial fibrillation, cognitive decline, even early mortality. Now the question becomes, how do we treat it effectively? Because knowing you have it is only the first step. Choosing and staying with the right treatment is the next life-changing step. Today we move from what is to what works. In fact, a large study looking at thousands of older adults on Medicare with an average age of about 73 found something really powerful. When people started and actually stuck with their sleep apnea treatment, using their positive airway pressure machine regularly and correctly, their risk of dying from any cause dropped. They also had fewer major heart problems like heart attacks and strokes. But here's the catch. Those benefits only showed up when the treatment was used properly. If it was used inconsistently or the mask didn't fit right, those protective effects pretty much disappeared. It's a powerful reminder that the treatment itself isn't enough. It's the commitment to using it consistently that truly protects the heart, the brain, and even saves lives. Let's begin with the gold standard, continuous positive airway pressure, or CPAP therapy. How does it work? Picture your upper airway as a collapsible tunnel. During sleep, muscle tone drops and the airway can collapse, causing apneas, hypopneas. You see, continuous positive airway pressure machine delivers a constant flow of pressurized air via a mask, keeping that tunnel open, preventing collapse, normalizing oxygen, and reducing brain arousals. As your body stays oxygenated, your brain isn't jolted awake repeatedly, and your heart isn't under constant strain. Here's the clinical evidence. In one large cohort of older adults, starting continuous positive airway pressure therapy and using it at least 4 hours per night was linked with a roughly 50% lower risk of death, compared with no therapy. Also, in a meta-analysis of randomized trials, patients who used continuous positive airway pressure therapy 4 hours per night or more had about a 31% lower risk of major heart and brain events. So yes, continuous positive airway pressure therapy works, but only if you use it regularly. When you use it the right way, it can actually undo a lot of the damage sleep apnea causes. Your breathing improves, your heart calms down, pressure inside your chest evens out, your heart doesn't have to work as hard, you wake up less often, and over time, your brain and heart both do better. Yet here's the catch. Many people quit continuous positive airway pressure machine or never use it enough. Common complaints include mask discomfort, feeling claustrophobic, air leaks, noise, nasal stuffiness, and intimacy concerns. As a physician, I always tell patients that continuous positive airway pressure therapy isn't a shortcut. It's a commitment, and to see it as daily medicine for your heart, brain, and overall health. Here's what you and your sleep team should focus on. Find the right mask style, nasal pillows, and full face that you tolerate. Ensure humidification if your nose dries. Fix leaks immediately. Set a realistic target and aim for at least 4 hours every night. It is a good idea to download usage data, check with your sleep doctor, and don't go it alone. I want you to hear this. In my practice, if a patient has moderate to severe sleep apnea, has high blood pressure, atrial fibrillation, heart disease, continuous positive airway pressure therapy is usually first line. It's the strongest therapy we have for these higher risk patients. But if continuous positive airway pressure therapy is not tolerable or anatomy suggests an alternate path, we have other options. That brings us to the next section. Now let's talk about options beyond continuous positive airway pressure therapy, oral appliances, and surgery. These are the next options when continuous positive airway pressure therapy fails or is not ideal. Remember, these are not lesser than continuous positive airway pressure therapy. They're simply different tools that may be better suited for certain anatomies, tolerances, or patient preferences. One size absolutely does not fit all. So, let's turn the corner. Oral appliances and surgery when continuous positive airway pressure therapy fails or is not ideal. Because the right fit matters more than the strongest fit. Here's where we go beyond the machine. Custom mouthpieces that hold your jaw forward, and surgical or implant options that target anatomy directly. It is often called a mandibular advancement device, MAD. What is a mandibular advancement device? It is a dental mouthpiece you wear while sleeping. It gently moves your lower jaw forward, which helps lift your tongue and the soft tissues away from your airway, reducing the chance of collapse. A systematic review found that in adults with mild to moderate sleep apnea, MADs reduced the apnea-hypopnea events by around 16.8 per hour on average, and improved daytime sleepiness and blood pressure. Another study concluded that although continuous positive airway pressure machine produces a greater treatment effect overall, MAD is a guideline-endorsed alternative for mild to moderate obstructive sleep apnea or patients intolerant of continuous positive airway pressure therapy. So, while they often don't reduce events as much as continuous positive airway pressure therapy, for the right person they can be a very good fit. So if you're continuous positive airway pressure machine intolerant or have mild, moderate obstructive, MAD is a very viable pathway. But I want to be transparent. Mandibular advancement devices work less than continuous positive airway pressure machine on average, especially for moderate to severe obstructive sleep apnea. And side effects include jaw pain, bite changes, tooth movement, and temporomandibular joint TMJ stress or stress on the jaw muscle are frequent complaints. As a physician, I tell patients that they still must have a follow-up sleep study to ensure the oral device is effective based on decreased oxygen level per hour, and any effects on the teeth or bite are carefully monitored. So, when your anatomy is more complex, you've failed. Continuous positive airway pressure therapy and mandibular advancement, MAD devices, or you prefer a longer-term fix, that leads us into the next level, surgery and implants. Now let's talk about the more advanced options and how surgery and implantable nerve stimulators are changing the game. Some patients have physical features that make airway collapse worse: large tonsils, a tongue that sits far back, a small or receding lower jaw, or excess soft tissue around the throat. In those cases, a sleep surgeon may perform surgery to remove or reposition those tissues, so your airway stays open more easily. Let's look at the evidence. For example, in one review of patients with very severe sleep apnea who didn't use continuous positive airway pressure machine, multi-level airway reconstructive surgery cut the average events per hour from approximately 69 to approximately 14, and about 74% of those patients met criteria for surgical success. So yes, surgery can be life-changing when chosen carefully. In short, if anatomy is the driver and you're a good surgical candidate, this may be your path. Here's one of the most exciting, newer options: the hypoglossal nerve stimulation implant. Hypoglossal, under the tongue, refers to the nerve that controls your tongue. In this procedure, a tiny device is surgically placed under your skin in the chest with a lead around a branch of that nerve, plus a breathing sensor. At each breath, the device nudges the tongue forward just enough so the airway stays open. According to the 2023 hypoglossal nerve stimulation trial, patients with moderate to severe obstructive sleep apnea who could not tolerate continuous positive airway pressure therapy showed clinically meaningful improvements in events per hour and quality of life. But who can qualify for this procedure? Well, you might be eligible if you have moderate to severe sleep apnea, events 20 to 65 per hour, have tried continuous positive airway pressure therapy and either couldn't use it or it wasn't effective, have a body mass index, BMI, of 35 or less, and don't have certain airway collapse patterns. As your physician narrator, I always emphasize that implants and surgery are not first line unless your anatomy and treatment history point that way. They require surgeons/sleep specialists, full evaluation, sleep endoscopy, imaging, and lifelong follow-up. Remember, surgery is invasive and may involve recovery time, pain, and cost. Clearly, some patients still require continuous positive airway pressure therapy or MAD use afterward, and be aware that success is highly individual. Here's the truth: even the best continuous positive airway pressure therapy, oral device, or surgery works better when you pair it with lifestyle and positional therapies. Think of them as the supportive team behind the star player. Let's talk about that next. Lifestyle changes aren't optional, they're foundational. For example, one trial of men with overweight and moderate to severe obstructive sleep apnea found that an 8-week lifestyle intervention, diet, exercise, better sleep hygiene, reduced or even eliminated need for continuous positive airway pressure therapy in many individuals. Also, simply avoiding back sleeping and instead sleeping on your side can reduce airway collapse for many. Reducing alcohol before bed, optimizing nasal breathing, lowering neck/abdominal fat. These all reduce how easily your airway collapses. Again, think of lifestyle as the supporting cast. Continuous positive airway pressure therapy, or oral device or implant, is the star player, but the supporting cast, side sleeping, weight control, nasal care, alcohol moderation, makes it a championship team. State another way, whether you're on continuous positive airway pressure therapy, oral device, or surgery, treat lifestyle modification like medication. Follow the prescription. Now, you might be asking, Doctor, which treatment is the right one for me? There's no universal answer, and that's important. No single treatment fits everyone. Your anatomy, your severity, AHI, your symptoms, snoring, daytime sleepiness, cognitive fog, your cardiovascular risk, your ability to stick with therapy, these all matter. And choosing the right treatment now could change your life. The treatments we've talked about really work. Using a continuous positive airway pressure machine for at least 4 hours a night has been shown to lower the risk of serious health problems and even death. A mandibular advancement device, or MAD, helps your body get more oxygen while you sleep and keeps sleep apnea under control over the long term. And for certain people, surgery can make a huge difference, reducing sleep apnea significantly and improving overall quality of life. But without monitoring and lifestyle commitment, your risk remains. So, if you have sleep apnea and you or your spouse keep saying, "I'm trying continuous positive airway pressure machine but still tired," or "I can't wear that mask," or "I'd rather not have surgery," then use this video as your guide to ask the right questions with your physician. Now, these are a few insights I've found especially helpful in my clinical work. 1. Adherence beats perfection. Even 4 hours per night positive air, way pressure machine usage gives major benefit. If you're using only 2 hours per night, you're not getting the same protection. 2. If your oral device leaves you with more than 10 to 15 events per hour still, that's a sign you might need more. In fact, that's a red flag, not a badge of completion. 3. Anatomy drives the decision. If you've got big tonsils or a small lower jaw, surgery or implant may be better. 4. Lifestyle is non-negotiable. Weight gain, alcohol, back sleeping all increase collapse risk. 5. Follow-up matters. Ensure regular checks of your therapy data, symptoms, device fit, or surgical outcome. 6. Follow-up care is essential. Regular sleep checkups once or twice a year, or sooner if new symptoms show up. And keeping track of how well you're using your device are key to long-term success. As a physician, I believe your best path is one you can stick with long-term. Not the ideal in a textbook you'll abandon after a week. Choose the therapy you will use, not the therapy you wish you'd use. Let's turn the snore risk into a success story. Remember, treat sleep apnea therapies like medicine. You've got to use them, track them, tweak them. Sleep well and protect your heart, kidneys, and brain. In our next video, we'll reveal lifestyle hacks to reduce sleep apnea naturally, small daily habits that anyone can do with big impact. Elderly wisdom meets modern science. So make sure to hit subscribe, turn on notifications, and share this with anyone who snores or is tired all day, because the right treatment could change their life. Until then, sleep well, stay safe, protect your heart and brain. I'm Dr. E. I. Williams.